Hello, hello, people. Hello, hello. Yep, hello. Yes, hello. Let's just wait for people. Let's just wait for others to come through. Let's wait for others. Let's wait for others. I have very important information to talk about when it comes to nursing. Let's just wait. Let us just wait. Let's just wait. Let us wait for people. Let us wait for people to come. Don't mind me. Oh. Yep. Yes. 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 Hi. You're welcome. Please share. 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 Bring other people on. Share. 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 I say share. 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 Bring other people on. Bring other people on. Share. 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 Bring other people on. Oh, Sheila Ladeji. Good afternoon, ma'am. You okay, mama? Are you okay, mama? Yep. Let's talk about nursing once more. Let's talk about nursing. Let's talk about nursing and some other things that is going on. Let's just talk about it. Nursing and some other things that is going on. We'll talk about it, then we'll talk about other things that is going on. We'll talk about it, then we'll talk about other things that is going on. Let me stop my television. Yeah, I am your host for today. Don't mind me, my network is very, very unstable. So you just manage it with me. But I can guarantee you something. You will get the message. That much I can say to you, you will get the message. Don't mind me, I just like crocheting. My time, I just like using my time to crochet. And apparently, crocheting happens to be one of the technique that you can use to make a patient that is suffering from some particular kind of mental illness that's got nothing to do with suicidal ideation or suicidal thoughts, you know, to just make them focus. Yes, crocheting happens to be one of them techniques you can use. Even you can use it for yourself when you find it difficult to crochet, when you find it difficult to be focused on something and you're all over the place and you just need to concentrate. So crocheting can be used as well. What I'm doing right now can be used as well because I'm trying to make a project that I don't know the title. I don't even know the name of the project. But today I want to talk to you about nursing being a ministry and the different kind of nursings that we've got that you can get into. You can jump on it right now. But before you jump on it, you must be ready. You must know what you really want. Because, like I said on my topic, nursing is a ministry. If you don't have the calling, you don't have the ministry, you cannot do it. Nursing is not a means to an end. I say it every day. Nursing is not a means to an end. It is not a means to an end. It's a kind of job that you must be a people orientated person. You must be a selfless person that wants to care for others. You must be an extra miler, a proper nurse. You must be an extra miler for you to want to do that profession. But what do I want to talk about today is a different kind of nursing and about agency nurse as well. I've come again to talk to you about agency nurse as well so that we don't get it all mixed up and you don't get people on you before they go and take your PIN number that you have really worked for. I won't lie to you, it's not worth the stress. It's not worth the stress. Postman, don't come. At what time? At after 3. Whoa. At after 3. That's okay. So, like I was saying, I'm not playing game. I'm not going to be accepting people that want me to play game. So, for you to come and join be part of my to be a co-host, you must have something to say. Please share, and like. Please share for me and like as well. It's a very, very crucial thing. Let me drop this. Like I said, my name is Nikki Badmos, AKMC Honorable Olaiwola. I'm a dual qualified nurse. I've got some things to say to people. Now, we have different kind of nursing. We have the mental health nursing, we have adult nursing, we have the learning disability, we have the midwifery, we have the children nursing, we have the general nursing. For you to be a qualified nurse, you must, and I repeat, you must have gone to the university to go and study nursing. Now, to some people, what they call university might be called college, but you must have a degree. For you, for now, for today, you must have a degree to be registered on the NMC register. And you get a PIN number that you will be the one protecting your PIN number by being competent and knowing what you are going to do. Whatsoever you are going to do that you have not been trained for, do not do it. No matter the durex, no matter the what do they call it? No matter what anybody says, do not do it. Because your PIN number, it's like your visa. Yeah. Let me share first. Let me share. Because some people need to hear this. Some people need to hear this. Let me share again. Let me share. Yeah, let me share again. Let me share on my. Let me add to story. Yeah, it's been added to my story. Let me see on my TikTok. Let me share it to this. Anybody that gets to you, just come and I'll just share it round. I'm not used to sharing, don't mind me. I'm not used to sharing. Yep. Yep, that's it. I've shared to my friends and they will come on. I've shared to some nurses as well. They will come on. Now, what was I saying? We've got different types of nurses. We've got the mental health nurse. We've got the adult nurse. We've got the learning disability nurse. We've got the children nurse. We've got all sorts of nurses. For you to be specialized, that's a different cup of tea. But for you to be a registered nurse that has a PIN number that will be used for them to call you a registered nurse, you must have gone to the university. In some countries, they call it colleges. You must have gone, you must have passed. You don't necessarily have to have a first class. You don't necessarily, just graduate. Graduate your degree. Graduate. And at the end of the day, you get onto the register. The moment you get your PIN number, it is your duty to protect your PIN number. Yes, now we've got associate nurses as well that has got PIN numbers in place. The difference between us registered nurses and the person that is not a registered nurse is because you, as a registered nurse, you're accountable for whatever you do. And in some cases, you're accountable for whatever happens in your ward, in your unit, to your patient that's been allocated to you. That's why I say it all the time that nursing is a ministry. People wonder why I say it's a ministry. It's a ministry because you must be selfless for you to want to take care of people that you don't know before. And if you think you want to go into nursing because of the money, you are joking. No. If it's because of the money, you are in a wrong profession. You cannot go and join nursing because of the money. It is not visible. It's not working. Now, what do I want to narrow all these things I'm saying? What do I want to narrow it down to? Is agency nursing. If you want to be an agency nurse, I will tell you the things that are involved. You want to be an agency nurse, I will tell you the things that are very, very involved. To be an agency nurse, normally they will say, oh, you must have gone through your preceptorship. After your preceptorship, then you can work. After you work and you're competent enough and you have your confidence, or you just feel the money is not okay, you just walk out because the agency pay more. Now, let me bust your bubble. The most important thing for you as a nurse to be an agency nurse is nothing but confidence and competence. If you do not have your confidence, you do not have your competence, and you want to be an agency nurse, you have set up yourself to fail. Let me repeat myself. If you, as a registered nurse, I don't want to know how long you have been a nurse for, and you are not confident and you are not competent, you have successfully set up yourself to fail. No matter who wants to be a nurse, don't worry, my network is not stable. Manage it like that for me, no vex. I think it's because it has rained and the weather is not right. Am I making sense? If you want to be an agency nurse and you don't have competence, you don't have confidence, you have successfully set up yourself to fail. That's the truth. You have successfully set up yourself to fail. That's the truth of the matter. No matter what the situation is, please, 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 and please, on no account should you leave your permanent job. Oh God. Hold on. Sorry about that. That was an important call. For you to be for you to be an agency nurse, you must have your confidence and you must be competent. Let me repeat myself. For you to be an agency nurse, you must have competence and you must be confident. Ask me why. Because you're going to be an agency nurse. You'll be going to different hospitals. You'll be going to different nursing homes. You'll be going to different care settings, depending on the setting you're registered with, right? You'll be going there to give care. If you are not competent, you might mess up. And when you mess up, remember, these are people's life. When you mess up, you might be called. They might report you. At the end of the day, take you to NMC and your PIN number can be restricted. I say it all the time. Do not think that because you're a nurse, you can go everywhere and anywhere. No, do not do that. I tell people all the time, do not think because I'm a qualified nurse now, I can walk everywhere. No, 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 no. There are some people, they are not fast-paced workers. I always advise them, go to outpatients or you go to a nursing home. Don't get me wrong. There are some nursing homes that they are fast-paced. Am I making sense? There are some nursing homes that they are fast-paced. And guess what? You might not be able to cope. And there are some departments, even in the hospital, that are not fast-paced. But can you cope with lots of people around you chatting? Can you cope with lots of people around you not allowing you to concentrate? Can you cope in an environment where everybody reports anybody? If it is a no, you cannot work in a ward that is fast-paced. I give you an example. A respiratory ward is fast-paced. This patient can be okay now, the next 5 minutes they have declined. And if you don't know what you're doing, that's you messing up. And I say it every day to people. If you think you're in nursing because of the money, you are in a wrong place. You cannot be in nursing because of the money. Because right now, as it is, even the agency are struggling to even pay you that money you think you can get. However, I repeat and I keep saying it. Make sure that whenever you want to be an agency nurse, you have your confidence and you have your competence. I've said it and I'm saying it again. Make sure when you want to be an agency nurse, you have your competence and you have your confidence. Because if you don't have this, you cannot be an agency nurse. Because you will find yourself in some places, in some situations that you cannot cope. And I always say it to people. If you know you qualify, you cannot go straight to nursing home. You decide to go to the hospital, the better. Go and work in the hospital in a ward. Try as much as you can. Don't be like me. But try as I encourage people, try as much as you can. Finish your preceptorship. Gain your experience. Gain your knowledge. It's only 1 year. The 1 year will be over before you call Jack Robinson. Put your feet on the ground. If you're not competent to do something, do not do it. No matter who tells you to do it, even if it is your ward manager, tell her, excuse me, I am not competent. I've not done my competency. I'm not competent to do this. Because guess what? If you do it, you are accountable for it. There's something they call accountability. You are accountable for what you have just done. On no account will you allow anybody to pressure you into doing what you are not competent of, no matter who the person is. That's why you open your mouth and talk, because it's very important as a nurse for you to be a good communicator, for you to be able to talk in a professional way, for you to be able to talk and to pass your message across. Not for you to not talk, for you to be able to communicate, because communication is the key. If you are somebody that talks at each other, I am very sorry you get into problems a lot. Listen, digest whatever they have said to you before you respond. If you don't understand it, tell them to explain it to you. After all, there are some people that didn't come from an English-speaking country. They still give them levity. Nigerians, we are English-speaking country. The reason why we get into problems is that we don't know how to listen. Most of us don't know how to listen. We just want to talk. We just want to do. No, you cannot do. This is people's life. You can't just wake up when you're not competent and you want to do. You cannot do. I repeat, you cannot do. You have to be competent. Please invite other people, please. If you are somebody that is thinking of going into nursing, this video is for you. If you are somebody that needs to work with people under the healthcare sector, this is for you. Because there are loads and loads of nurses out there that they get into trouble. They are very good at what they do. They get into trouble because of their communication skills. They don't have it. If you're an international nurse and you're coming into this country, have it at the back of your mind, your communication. You have to learn and unlearn some things. You know, us as Africans, we speak loud. You have to be intentional about learning how to speak to people, because communication is the key, and you must be able to listen effectively to get whatever you want to, whatever instructions that you have been given, to get it across before you get yourself into trouble and the PIN number that you have been keeping all this while gets restricted or taken off you. I say it all the time. It's not like we black nurses are no good. We are good, but our communication is a problem. Guess what I've worked with? I'm working presently with a Filipino. This lady is very good and very helpful at what she does. But it takes me my patience to listen to her and know what she's saying to me. That is my own patience. I have to devise a means, because she's a team worker. She works as a team. If she's with you and she feels that, oh, I've got 20 patients, let me give you an example. I was at work, and the place I was working, I was at the topmost floor. I have 21 patients. Then downstairs, she had 12 patients. Do you know what she did? Despite the fact that she cannot speak good English, she came upstairs and said to me, Nikki, you pop it and I give it. I told her, okay, you know what? I'm in number. I listened to her. I got what she meant, right? With the way she can speak her own English, not being proper language now. You understand? But the tone in which she spoke to me, she has come to help me upstairs. She's Filipino. She's come to help me upstairs. What did I tell her? I said, okay, just hold on. I've got to go and give this medication to my patient. Do you know what she did? I don't think she understood what I said. Instead, what did she do? She told me to bring the other key. I gave her the other key. She said, I'm going there. I pop the medication. I give it. Me, I'm even speaking it well. So thank you very much. Palm one Abake. Thank you very much. You understand? And when she said that, and I was busy doing my other medication, taking care of my patients, my residents were running up and down. They were not stable. My support workers, they really tried that night. But do you know just that help that she helped me went a long way. Remember, we don't speak the same language. Remember, our English is not good. But I had to devise a means. What was this means? To be patient and to put on my listening ear. And that was how she helped me. Thank you for liking it. Thank you. I really do appreciate you. Palm one. Sam one. Thank you very much. I appreciate you. Thank you. Thank you for liking it. Please share, and like. I mean, am I making sense? She helped and we worked as a team. And that, honestly, you see, she doing that part that has only 8 patients and I was busy with the remaining. No, I had 22 patients. I was busy remaining with the 18 patients and they were quite hectic. I won't call them patients, I call them residents because it was a nursing home. Guess what? It went a long way for me. That is what they call teamwork. Do you understand? That's what they call teamwork. She did not look at the fact that because she cannot speak English, she's not going to help me because I will not understand that. No. She couldn't speak English properly, but she can convey a message. All I needed was for me to be patient with her. And guess what? We had a fantastic shift. It was just a matter of patience and me putting up my understanding, my knowledge at, because I won't lie to you. I will not lie to you. There was a resident that was handed over to me and said I should monitor. It's like she's in her last days. When I went to look at that resident, I looked at the resident properly. The resident appeared dry. What did I do? I started pushing fluid for this resident, and this resident kept coming around gradually. Do you know that when she came and I went to her, she said, what am I doing there? In her own way that she could understand. I could see she's struggling in her own way that she could understand. I now show her the handover they gave to me. She now told me that we should go together. This was a resident that was not opening their eyes. Do you know what she did? She now did capillary feel. This was all she did. She pressed it out and released it immediately. This resident opened her eyes and screamed. To some people, they will say she has inflicted pain. No. That is, we wanted to know before we start calling the ambulance. We wanted to know why this patient wasn't responding. The fluid I pushed and what she did, that particular thing she did, helped us to know that this patient can respond properly, but this patient is going through dehydration. And I placed this patient under hourly ops and everything started coming up. Am I making sense? So you see, in nursing, it takes more than you alone. I tell my fellow nurses, I said, in this profession, no man is an island. But the dangerous part is that some people that have stayed in that nursing for so long, when you see these people that are newly qualified asking questions, like I said, I belong to Triple N UK. I belong to Triple N UK. This is a body that helps the Nigerian nurses' voice to be heard. Thank you very much. I just love this psalmist. Sam Abba Ake. Thank you very much. I appreciate you. I appreciate what you're doing. Thank you. Am I making sense? Every other country has their voice to be heard. Nigerians, we don't have our voice to be heard. You ask them because they say come and pay a monthly, yearly dues or monthly dues. You have a problem with that. But you keep forgetting. A lot of people has come to me and has ended up joining Triple N UK. They came with problems. And Triple N UK solved it. They solved that problem because you're a financial member. The CEO had to take it upon herself, go for this, your meetings, and spoke on your behalf and tell us and was able to tell them, oh, this is where you're getting it wrong. This is what you're going to do. Communication goes a long way. When you have communication skills appropriately, because I won't lie to you, Nigerians, sorry, if you want to join me, you have to tell me why you want to join me. Comment downstairs and I can add you. I don't want a situation whereby I will just get somebody that wants to play game. No, I'm not here to play game. I'm here to create awareness about nursing and what about our communication skills. We need to learn how to communicate. Thank you, my sister. Thank you very much. Thank you very much. In this nursing profession, we need to learn how to communicate because communication is a paramount thing, is one of the vitals, and is very, very important. Although my colleague could not communicate properly with me, but I understood her, right? When she goes to the patients as well, she knows what she wants to say. She knows how to say hello, hi. She doesn't have to speak Queen's English. That is why you see the Indians. Somebody was complaining to me that all these Asians, they are taking everywhere. They are doing this, they are doing that. I said, do you know why? She said, well, I said, because when they go to a ward, they move a mass. And if you watch their clique, there's somebody that is always in charge in that clique. And that person is the one that puts them through. They listen to that person and they carry on. But we blacks, especially Nigerians, we start forming and band 100 and band 50. When you ask them questions, one newly qualified came to me and was almost crying. And I told her, with the rate at which you're going, you might lose your pain. You might lose your pain. Be careful. Calm yourself down. If you cannot, look for another job in another ward or leave that trust as a whole. She said, Auntie, that's why I came to you. I said, yes, leave that trust as a whole. Because if you're the person that used to go to work happily before, all of a sudden you want to go to work, you become very sad. You're not happy. And your heart starts pounding because somebody is going to pull you up. I said, who are the nurses in your department? She said, oh, all the nurses in my department, apart from myself and a black lady, others are Asians. I said, and your manager? She said the same thing. I said, the culture is going on there. Have you called NMC? Have you called RCN? You understand? She said, because she can speak one of the Nigerian languages, but she's not in Nigerian. You know, she just loves Nigerian language. You understand? So she now picked the Yoruba. I said there was a nurse there that is Yoruba that used to speak Yoruba. I want to speak Yoruba to ask her some things, right? I don't want these people to know what I was asking. And the lady just turned around and said, speak English, speak English. Say, guess what, sis? I said, what? Other Asians were speaking their language in that place and they were getting things done. I told her that's how some of us behave. And we don't know we are just destroying one another. Because an Asian culture is going on. And you see, don't get me wrong. I'm sure if I call that nurse as well, she will have the reason why she's like that. Because from my own experience, I remember telling a younger colleague, she's newly qualified. I told her, because at the end of the day, you will be held accountable. Do you know what she told me? She turned around to me and said, please, Auntie, speak English. No, not Auntie. Please, Nikki, speak English. I said, by the time I was through with her on that shift, I don't like give you. She carried dictionary. And I refused to speak that language. When she was speaking language with me, I looked at her, I smiled, but I responded to her in English. I responded to her in English. I didn't tell her speak speak English. I responded to her in English. So after the shift, as she was going home, I told her, excuse me. She came. I said, next time, when somebody's trying to warn you, don't think you're smarter than the person. Why would you tell me to speak English when every other person that is here, all they're speaking is their dialect and they're getting things done? And I don't want you to go, I don't want you in trouble. And I told you, you're telling me to speak English. Now, if I speak one English, you are telling me, please, what do you mean by that? No, now you won't hear English. So make with the speaker. You understand? Since then, she has stopped. So I'm careful when I get around my black people and then they are Yorubas. I don't want a situation somebody will tell me speak English. So I'm very, very careful. Unless they are the one that uses Yoruba to come to me and first, then I can respond in that dialect. Because that day I was shocked to my bone marrow. And I told myself, if I begin speaking English now, this babe will carry dictionary. And I wasn't joking. She carried dictionary. Ordinary small thing that I will speak, she'll be asking me, hey, I don't understand what you mean by that. Oh, do you understand? So to be a nurse is not, Gary, to be an agency nurse when you don't have competencies and confidence, you're setting up yourself for failure. I will say it anytime and I will tell you every day. You're setting up yourself for failure. If you want to be an agency nurse, make sure you have your competencies. You have your confidence. You can put your legs on the ground and tell them, I cannot do that because I'm not competent enough. It's as simple as ABC. Even NMC will not kill you. It is when you go and do something after committing blunder, you now say, I'm sorry, I've not done the competency. No, but you went ahead to do it. You went ahead to do it. Your manager tells you come and cannulate and you have not cannulated before. You have not done the competency before. Tell your manager you cannot cannulate. There are some nurses, they are band 7, they are band 8. They cannot cannulate. Because they are band 7 and band 8, they don't even give medication anymore. They don't do clinicals. It will shock you. But that's what happens. They don't do clinicals. So why would you, that is not band anything apart from your band 5, not go for your competencies and make sure that you are signed off before you start doing it? Then you wake up one day, oh, because they are sending you away, because of they are stressing you at work, you want to do an agency. You that don't have confidence to speak to your colleagues, is it you that want to go and do agency? You're setting up yourself to fail. And once you fail, they'll go for your PIN number. They will say you are fitness to practice. And sometimes I will not lie to you. I will use my dialect to speak this one now. Igba mi, àwọn people yẹn wọ́n kàn fẹ́ gba PIN number lọ́wọ́ wa ni, because they don't like the fact pé àjọ wà ní the same level. Yeah, Igba mi wọ́n fẹ́ gba PIN number lọ́wọ́ wa ni. It is you that will not allow them to collect it off you. Ìwọ ló ní gbà. That's why your competency matters. I'm going to work somewhere that I know nothing about now tomorrow, but I know that no matter what they want to do there, I know what they do there. But I've not worked in that setting before, but I know what they do there. So I already told them, you're giving me induction. If you're not giving me induction, I'm leaving you and going. Not be go, come back. Not be Gary, not be my. I will leave you and go. I'm not joking. My consultant said, yes. Are you serious? I said, yes. And the most important bit is my documentation. It's very, very important. Let me give you an example. A patient went into respiratory arrest. That patient is not supposed to be on that ward because that's a stroke ward. One of the band 5 already called and asked, why did you bring this patient here? This patient is not in the right ward. This patient is in critical condition. This patient is supposed to go to ICU. They said, no, we don't have beds and everything like that. So she called all the doctors, informed them. The doctors did all they could do because the patient's life was their main priority as of that time. That's listen to me. Oh, the patient's life was priority to everybody. So she did the gas, she did this, she did that, she did everything. The doctors too were doing it. So finally, a consultant called and told the ICU people to come and collect this patient. Are you understanding me? After they've tried to stabilize this patient, the consultant called that they should come and collect this patient. Are you understanding me? Now, remember, they did everything. Now, the doctors forgot to document. No, they didn't forget to document. They feel when they get to their office, they'll go and document. But this band 5 remembered. As they were taking the patient, she said, please, I want to document. They said, no, you document later. She said, no. She wants to just document. She just put bullet point, bullet point, bullet point, bullet point, bullet point. Guess what? This is how dangerous, as sweet as nursing is. Your slightest mistake can get you into trouble. Serious trouble. The moment they took this patient to the ICU ward, do you know what they did? When they found out that this thing is out of hand, they just blocked that patient's notes. Nobody could access the patient's notes. The doctors were complaining that they cannot access this patient note. They want to write notes. When this band 5 nurse now decided to go and access it, she couldn't access it. They've blocked it. Guess what the ICU was doing? They were now saying it was not escalated enough on time. And that was a lie. And not that in nursing, if it was not documented, it never happened. Are you understanding me? No matter how busy you are, document as you go everywhere. And if a patient is going to leave the ward in which you are, please, 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 and please, before you go with them, if they cannot get a porter, they need you. Before you go with them, do documentation. Because you never know what's going to happen. When that patient passed on, he went to the coroner's court. Do you know it was that 10 bullet points that band 5 wrote, that saved the whole ward from getting into trouble? Because they took it to the coroner's court, they now said, where is the documentation? Doctors could not provide documentation. Instead, doctors were saying they did this, they did that, they did the other one, accepted, but where is the documentation? The girl now said, oh, she did documentation. She wrote bullet points, even where the doctors wrote. That was how everybody was on that girl. They now wrote letter to the girl that she should please expatiate. What does she mean by this? What does she mean? That was what saved them, or else they would have entered into big trouble. That would have been fitness to practice. That would have been, you are not competent with your documentation. Remember, it's somebody's life. They were trying to save somebody's life to leave the documentation. That is what nursing is about now. Even if not fly past, document them. It's very, very important. Your documentation in nursing is as good as the care you're giving to your patients. It's very, very important. It's very, very important. I cannot overstress it. On no account. On no account should you take care of a patient and you don't document. Even when they are sending that patient out of your ward and you're supposed to go with that patient, please, not be on paper. Put it down inside that patient's notes, because they will tell you it never happened because it was not documented. Even when they know that it was a serious thing, that documentation was what saved them. I am telling you, it was the documentation that saved both the doctors, the ward, and every nurse that was on shift that day. So you see how difficult it is. You see how some people that are not fast-paced workers, they cannot work in a fast-paced environment. I always tell them, know where you can work. If not community, go to community. No matter how long. Formerly, to get a job is easy. But now they flooded the country with international nurses. So to get the job now, it takes the grace of God. But it's better you are patient and you're doing your support worker job or something else than you losing your pain because you are impatient, because you just need a job. No. You need a job. Nothing is more than that. You have to be selfless. Your documentation has to be spot on before you be an agency nurse. Have your competencies and confidence to stand up to anybody in a professional manner. I do not have the competency for that. I cannot do it. It's better than say, oh, let me try it. Now, person in life, you won't take try. Now you won't take play kite. No, you can't use somebody's life to play kite. If anything goes southward, it is you that will be accountable for it. It's nobody else. because now you decide, say, you want do am. Nobody force you to do am. I say it every day. Nobody force you to do am. And nursing is a teamwork. There is no way, no matter how brilliant, how intelligent you are, there is no way you can be an island in nursing. No, 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 no. You can't know it all. There is no way. If you find yourself in a ward where they are always reporting this, reporting the flyway pass, reporting this, and you have told the management nothing can be done, leave the ward, not be by force. Leave the ward, take a transfer, not be by force. There are loads and loads of examples that I can give, but I've just come to tell you because some people, I have 2-3 people that's come to me. I want to be an agency nurse. What's the problem? Because they were stressed on the ward. Okay, what make una stress? This, that, the other one. And when I was talking to them, I find out that they are not competent and they don't have confidence. I said, if I tell you to go agency, I'm setting you up because you still need supervision. I'm setting you up for failure. So I've come to bring it to you today. Your competencies and your confidence goes a long way. Professionalism is very, very important. And working as a team is as important as the job you're doing. Now, your documentation has to be spot on. That when somebody else pick it, they don't need you to write plenty English. That's one good thing about it. Write the normal English that anybody can understand. What thing you don't know, be say, you say you both will get Queen's English. They need to write plenty English. They need the right plenty English. They know the right plenty English. No. What thing happen and then go right put there. Nothing else. What thing happen and then go right put there. Nothing else. Nothing special. Nothing else. Is that thing that has transpired, they are going to write. How you want to see it is your own cup of kuno. Please, I would like, if you know you're a nurse and you want to join this discussion, please come up. Please send me an invite. Comment here. I'm a nurse. I want to join. I want to co-host with you. Please, please, please come up. Or if you have a question, you can ask. My communicating. If you have a question, you can ask. That's it. You can ask. If you have a question, even if it's how to be a nurse in UK, what happens with sponsorship and stuff like that, ask me. I'm not playing game. There are some people I will not pick because I know they are gamers. And I'm not playing game right now. No, the game where I won't play. The thing where I know Sabi where I won't play. Right? The thing where I know Sabi where I won't play. Nursing is beautiful. You have to be selfless. You are taking care of people you don't know before. And when you have your PIN number, protect your PIN number. It does not mean that you should throw other people under the bus. I repeat, it's not because you want to protect your PIN number, the thing you're supposed to call your colleague to discuss, you now throw them under the bus. That is not fair. It's not just fair. You should be able to talk to one another. Especially if I say Daki and Daki, they put themselves under boss. When we say young people, they cover up themselves. Before you can see an agent get into trouble. I never seen him before. For as long as I've been a nurse, I've never seen him before. But I've seen my Daki person get into trouble. And guess what? Now Daki I can set them up. Just for question. Wenubia. Am I making sense? In nursing, no man is an island. I can tell you that. In nursing, no man is an island. We work together as a team in nursing. And if you are that person that is always reporting your colleague for no just reason, and you think say they go promote you like that, you lie. Okay, let me give you another example. There was this nurse, she was put in a ward as a band 6. So every other Daki person will ask her questions. Now she go always say, speak English. We at work, speak English. Every other people, they were speaking their own dialect. But she's fond of telling you to speak English. So that our band 6 come they shack and well. Am I communicating? It was shacking her left, right, and center. In shack and so they shack and reach where I did. I was now laughing. I was laughing because one, I'm an agency nurse there, and I told her if I want position, I no go leave NHS. One day I was on shift with her. The manager called her into the office. And she happens to be one of the longest nurses that is still in that ward. And according to her, people that she has been mentored for, they are putting them in band 6. Some are getting promotion by the day, by the minute. She's still in her band 5. Then she got this promotion. What do you think the manager called her into the office for? Told her she has to leave that position now. She's no longer a band 6. She's still a band 5. They just needed someone to fill that one up, that they don't think she can do it, and give it to a white person. This girl wanted to die. She won't do it, she won't buy. The thing pain and enter inside blood. When she came out, her eyes were red. I can't look and come on my face. I can't look at but myself now. And I went to her, are you okay? She said, that was how she busted though. And I took her to the toilet. I said, what's the matter? She cried and cried and cried and cried. Now said all the old story, Latin 19.2. And I told her, do you know you are the architect of your problem? She said, how? You have been in this world for 25 years. And everybody you have mentored is your boss. Do you know why you are still here? She said, why? I said, no. She said, it's because she likes the word. I said, no. You are not here because you like the word. You are here because you're scared of new challenges. Go and apply for a band 6 job outside in another world and see yourself get that job and be happy. She stood there and was looking at me, her eyes dry instantaneously. I said, it's the fear of new challenge that is scaring you. Me, anything more stay in a particular place for how many years? She mo crazy ni. I be one deal tamini. I no fit. I'm not your regular nurse. So I can tell you a lot about nursing. Am I communicating? Like I said, crocheting, when I was actively practicing as a mental health nurse, was one of the techniques we use for patients that finds it difficult to focus. This distresses you. It's a technique, and I've learned it all the way from Nigeria when I was a baby. Now this thing I can't take be project supervisor. Are you understanding me? So it's very, very good. It distresses somebody. So like I was saying, that was how she started applying. She has gone for a series of interviews. I told her, just be patient. If you don't get it, keep applying. You will get it eventually. Because by now, with your 25 years, and you are not an agency nurse, that's the worst part. No, you're not an agency nurse that is self-employed. You're just stuck to this one place because you're scared of new challenges. That's why you're taking it out on your other people. I should not be angry. That day she was in a bad mood. I said, every day now you did a bad mood. Now so the bad mood plenty week. You dey inside that bad mood, you carry and do me, carry and do your work colleague. At least me, I just they come, they go now. I mean, I'm not saying you. It's this same you that is giving you ideas. I say from then she don't repent to. She don't even follow them, they vex. But I'm very positive. I am very, very positive. She's going to get that job because she's competent. She knows what she's doing. She's competent. She knows what she's doing. It's just that when an Asian fool that word, and the Igbo way they there, they don't buy them over. Are you understanding me? That's how it is. Nothing is beautiful, but it's got its own challenges. But if you have your competencies and you have your confidence, you will talk to anybody in a professional manner and when you communicate and you make your point in a very professional manner, and they will know you know what you're saying. So they become scared of you. But on no account should you transfer a patient from your ward without documenting at least something, because you don't know what's going to happen to that patient from that place to the next place. That's how terrible it is. That's how terrible it is. Anyway, that's just the small information I came to give you on nursing. I'll come back to do something else. Until I meet you again, take good care of yourself. By the next time, I should be able to tell you I finished my heart. Take care and God bless you.